Stop taking your medications exactly as prescribed right now and listen to what I'm about to share with you, because this could be the most critical 15 minutes of health information you will hear this year. And I say that not to be dramatic, but because millions of seniors across America are taking common prescription medications every single day, not knowing that these drugs are directly linked to accelerating cognitive decline, memory loss, and even rapid onset dementia in adults over 60. Most doctors, including many neurologists and primary care physicians, are still not prescribing alternatives or even warning their patients over 65 about this connection. Let me tell you about Harold. Harold was 73 years old, a retired accountant from Portland, Oregon. Sharp as a tack his entire life, managed complex financial portfolios well into his 70s. His wife noticed subtle changes at first. Harold would forget where he parked at the grocery store. Then he started repeating the same stories within hours. Within 18 months of starting a new combination of medications for his blood pressure and sleep problems, Harold could no longer recognize his own grandchildren. His neurologist eventually identified medication-induced cognitive impairment, but by the time they caught it, significant damage had already occurred. Harold's story is not unique, and number 2 on this list is a medication that over 40 million American seniors take every single night, believing it is helping them sleep better, when in fact it is quietly dismantling their brain's ability to form new memories. I am Dr. William Lee, a physician scientist, medical researcher, and vascular biologist who has spent over 25 years studying how medications affect the aging brain at the cellular level. I have worked with research teams at institutions including Harvard Medical School and have dedicated my career to understanding why the aging brain responds so differently to common medications compared to younger adults. And what I have discovered through both research and clinical practice has genuinely alarmed me about how casually certain drugs are prescribed to our senior population. A landmark study published by researchers at the University of California, San Diego, and followed by teams at Indiana University School of Medicine tracked over 73,000 adults aged 65 and older for a period of 7 years. What they found was extraordinary and deeply concerning. Adults who consistently used certain classes of medications showed a 44% increased risk of developing dementia compared to those who did not use these drugs. The most shocking part? Many of these medications are available over the counter, meaning seniors are taking them without any medical supervision whatsoever, not knowing they are potentially destroying their cognitive future one dose at a time. Today, I am going to break down the 5 most dangerous medication categories for brain health in adults over 60, ranked from concerning to absolutely critical. These are medications that millions of seniors take daily, often for years, without understanding the devastating neurological price they may be paying. By the end of this video, you will know exactly which medications pose the greatest risk, what biological mechanisms make them so dangerous specifically for aging brains, and most importantly, what evidence-based alternatives exist that can address your health needs without sacrificing your cognitive function. Before we dive in, I want to ask you something personally. Leave a comment below telling me your age and whether you or someone you love has experienced unexplained memory problems or confusion after starting a new medication. I read every single comment on this channel, and your experiences genuinely shape what I cover next. Your story matters, and this community has become a place where we share real experiences that doctors often dismiss or overlook. Coming in at number 5, and this one surprises almost everyone I tell it to, we are talking about proton pump inhibitors, commonly known as PPIs. These are medications like omeprazole, which you know as Prilosec, esomeprazole sold as Nexium, and lansoprazole marketed as Prevacid. If you suffer from heartburn, acid reflux, or GERD, there is a very high chance you are taking one of these medications right now, possibly every single day. Here is what is happening inside your aging brain when you take PPIs long term. After the age of 65, your brain's ability to absorb vitamin B12 declines by approximately 30 to 40% compared to younger adults. Vitamin B12 is absolutely essential for maintaining the protective coating around your nerve cells called the myelin sheath. Think of myelin like the insulation around electrical wires. Without proper insulation, the electrical signals in your brain start misfiring, crossing wires, losing signal strength. That is exactly what happens when B12 levels drop too low. Proton pump inhibitors work by dramatically reducing stomach acid production. That sounds helpful for reflux, but here is the problem. You need stomach acid to break down and absorb vitamin B12 from the foods you eat. When you shut down acid production for months or years, which is exactly how most seniors use these medications, your B12 levels slowly decline. A comprehensive study from the Journal of the American Medical Association analyzed over 25,000 patients and found that seniors who use PPIs for more than 2 years showed a 65% higher risk of vitamin B12 deficiency compared to non-users. That deficiency directly contributes to confusion, memory problems, difficulty concentrating, and progressive cognitive decline that looks remarkably similar to early Alzheimer's disease. Let me tell you about Margaret, a 71-year-old retired school teacher from Tucson, Arizona. Margaret had been taking omeprazole for nearly 4 years for her acid reflux. She started noticing she would walk into rooms and completely forget why she went there. She began struggling to remember her students' names at class reunions, something that had never been difficult for her before. Her daughter brought her to my practice genuinely worried about early dementia. When we ran her blood work, her vitamin B12 levels were critically low, below 200 picograms per milliliter, when optimal levels for brain health should be above 400. We worked with her gastroenterologist to transition her off the PPI using dietary modifications, elevating the head of her bed, and implementing smaller, more frequent meals. Within 6 weeks of stopping the PPI and beginning B12 supplementation under medical supervision, Margaret noticed her mental clarity returning. At her 3-month follow-up, she told me with tears in her eyes that she felt like herself again for the first time in 2 years. If you are currently taking a proton pump inhibitor, the practical recommendation is this. First, do not stop any prescribed medication without consulting your physician. That is critical. But do schedule a conversation with your doctor about how long you have been on the PPI and whether alternatives might be appropriate. Many cases of reflux can be managed through elevating the head of your bed by 6 inches, avoiding meals within 3 hours of bedtime, and eliminating trigger foods. If you must continue the PPI, ask your doctor about monitoring your B12 levels every 6 months and potentially supplementing if levels decline. The research from Mass General Hospital suggests that seniors on long-term PPIs should maintain B12 levels above 500 picograms per milliliter for optimal brain protection. Here is a synergy tip that the research supports. If you are taking a PPI and cannot stop it immediately, pair it with foods naturally high in B12 that your body can absorb more easily. Wild-caught salmon, grass-fed beef, and eggs can help, but you may need supplementation. Methylcobalamin, the active form of B12, bypasses some of the absorption problems caused by low stomach acid. Work with a knowledgeable practitioner who understands this connection. Number 5 is serious, but number 4 is where the evidence gets truly alarming. Moving to number 4, we are talking about anticholinergic medications. This is an entire class of drugs that includes antihistamines like Benadryl, bladder control medications like Detrol and Ditropan, sleep aids including many over-the-counter options like Tylenol PM and Unisom, antidepressants such as Elavil, and even certain muscle relaxants. The reason these are ranked higher than PPIs is because the cognitive damage they cause is more direct, more immediate, and potentially more permanent. Let me explain what is happening at the cellular level when seniors take anticholinergic drugs. Your brain relies on a neurotransmitter called acetylcholine to form memories, process information, and maintain cognitive function. Think of acetylcholine like the messenger service in your brain, carrying information from one brain cell to another. After age 60, your brain produces approximately 25% less acetylcholine compared to younger adults. Your cognitive reserve is already reduced. Anticholinergic medications work by blocking acetylcholine receptors. It is like shutting down the postal service while expecting letters to still get delivered. A groundbreaking study published in JAMA Neurology by researchers at the University of Washington followed over 3,500 adults aged 65 and older for more than 7 years. They measured cumulative anticholinergic exposure and performed brain scans. What they discovered should terrify anyone taking these medications long-term. Participants with the highest anticholinergic exposure showed brain volume reduction equivalent to 4 to 6 years of aging, lower glucose metabolism in the brain, which is an early marker of Alzheimer's disease, and a 54% increased risk of developing dementia compared to those with minimal exposure. The most insidious part of this research is that the damage appears to be dose-dependent and cumulative. Every pill you take adds to your total anticholinergic burden. Seniors often take multiple medications that all have anticholinergic effects without realizing they are compounding the damage. Your doctor prescribes Benadryl for allergies, Detrol for bladder control, and Tylenol PM for sleep, not recognizing that the combined anticholinergic load is overwhelming your aging brain's capacity to function. Robert was 68 years old, a retired electrician from Phoenix, Arizona. He had been taking diphenhydramine, the active ingredient in Benadryl, every single night for nearly 3 years to help him fall asleep. His wife noticed he was becoming increasingly forgetful and confused, especially in the mornings. He would ask her the same question 3 times within an hour. He started getting lost driving to familiar places. His primary care doctor ran standard dementia screenings and found significant cognitive impairment. When I reviewed his medication list during a consultation, the connection became immediately clear. We worked with his physician to eliminate the anticholinergic sleep aid and transition him to safer alternatives, including melatonin, magnesium glycinate, and cognitive behavioral therapy for insomnia. Within 8 weeks of stopping the anticholinergic medication, Robert's wife called me. She said he was sharper, more present, more like the man she married. His follow-up cognitive testing showed measurable improvement, though some deficits remained, a sobering reminder that catching this early matters enormously. If you are taking any anticholinergic medication, here is what you need to do. Make a list of every single medication you take, including over-the-counter drugs and supplements. Take that list to your pharmacist and ask them to calculate your total anticholinergic burden score. Pharmacists have access to tools that score each medication's anticholinergic effect. A score above 3 significantly increases dementia risk. Work with your doctor to find alternatives. For sleep, consider melatonin, magnesium, or addressing the root causes of insomnia. For allergies, newer antihistamines like loratadine have far less anticholinergic effect than diphenhydramine. For bladder control, pelvic floor physical therapy has shown remarkable results in clinical studies without any medication at all. Here is your synergy protection strategy. If you must take an anticholinergic medication temporarily, support your brain's acetylcholine production through nutrition. Eggs are rich in choline, the building block of acetylcholine. Alpha-GPC, a supplement form of choline, has been studied at the University of Milan and shown to support cognitive function in seniors. This does not eliminate the risk, but it may help protect your brain while you work on safer alternatives. Now let us move to number 3, and this is where things get genuinely shocking because this category includes medications that over 30 million American seniors take every single day. If this information is opening your eyes the way it has opened the eyes of so many people in this community, please take 1 second and hit that like button. And if you are not yet subscribed, I invite you to join us. I publish evidence-based content specifically for people in their 60s, 70s, and beyond every single week, and it is completely free. Subscribe and ring that bell so you never miss a video that could protect your brain health and independence. Number 3 on our list is benzodiazepines. These are medications like Xanax for anxiety, Ativan often prescribed for sleep or anxiety, Valium for muscle spasms or anxiety, and Klonopin for panic disorders. If you have ever been prescribed something to calm your nerves or help you sleep, there is a significant chance you have taken a benzodiazepine. The problem is that what calms your nerves in the short term may be quietly destroying your brain's ability to function in the long term. Here's what happens in your aging brain when you take benzodiazepines. These medications work by enhancing the effect of a neurotransmitter called GABA, which slows down brain activity. That is why they make you feel calm and sleepy. But after age 65, your brain's ability to clear medications from your system declines by 30 to 50%. What this means practically is that benzodiazepines accumulate in your brain tissue, staying active far longer than they would in a younger person. A dose that would clear from a 40-year-old system in 8 hours might linger in a 70-year-old's brain for 24 to 36 hours. Research published in the British Medical Journal analyzed data from over 1,900 seniors who developed dementia and compared them to over 7,100 control subjects who did not. The findings were stunning. Seniors who had used benzodiazepines for more than 3 months showed a 43 to 51% increased risk of developing dementia. The longer the duration of use, the higher the risk. Those who used benzodiazepines for more than 6 months showed risk increases approaching 60%. The mechanism is not fully understood, but neuroimaging studies from Stanford University School of Medicine show that chronic benzodiazepine use is associated with reduced brain volume in areas critical for memory and learning, including the hippocampus. The hippocampus is ground zero for Alzheimer's disease. Any medication that accelerates its decline should be avoided in seniors whenever safer alternatives exist. Dorothy was 78 years old from Baton Rouge, Louisiana. She had been taking Ativan for anxiety for over 5 years, initially prescribed after her husband passed away. Her daughter noticed that Dorothy was having increasing difficulty with everyday tasks. She would leave the stove on. She forgot to pay bills for the first time in her life. She became disoriented in her own neighborhood. When I reviewed her case, the long-term benzodiazepine use was the obvious concern. Working closely with her psychiatrist, we implemented a very slow taper over 4 months, reducing her dose by tiny amounts every 2 weeks, while introducing non-pharmaceutical anxiety management, including gentle daily walks, regular social connection through a grief support group, and magnesium supplementation, which has natural calming effects. The process was not easy. Benzodiazepine withdrawal must be done carefully under medical supervision. But 6 months after completely stopping the Ativan, Dorothy's daughter reported that her mother was more alert, more engaged, and showing significant cognitive improvement. Her brain fog had lifted considerably, though some memory deficits remained. If you are currently taking a benzodiazepine, I want to be absolutely clear. Do not stop suddenly. Benzodiazepine withdrawal can be dangerous and must be done under careful medical supervision with a very slow taper. But do have an honest conversation with your prescribing physician about the cognitive risks and whether alternatives might be appropriate. For anxiety, evidence-based alternatives include cognitive behavioral therapy, which has been shown in numerous studies to be as effective as medication for generalized anxiety disorder, regular physical activity, which naturally regulates stress hormones, and mindfulness meditation, which multiple studies from Massachusetts General Hospital have shown can reduce anxiety symptoms without any medication. Here is your protection strategy if you must take a benzodiazepine short term. Use the absolute lowest effective dose for the shortest possible time. Ask your doctor about non-benzodiazepine alternatives like hydroxyzine for anxiety or trazodone for sleep, which may have less cognitive impact. And actively work on addressing the root cause of your anxiety or insomnia rather than simply masking symptoms with medication. And now we arrive at number 2, the one I teased at the very beginning of this video. This is the category that shocked me most when I first saw the research, because these are medications that millions of seniors take every single night, believing they are simply helping them sleep better. Number 2 is sedative hypnotics, specifically medications like Ambien, Lunesta, and Sonata. These are the go-to prescriptions when seniors complain of insomnia, and they are handed out like candy despite mounting evidence of serious cognitive consequences. Over 12 million American seniors take these medications regularly, and the vast majority have no idea about the brain damage accumulating with every dose. Sedative hypnotics work differently than benzodiazepines, but they target the same GABA receptors in your brain. The critical issue for aging adults is that these medications do not produce natural restorative sleep. Instead, they sedate you into an unconscious state that looks like sleep but lacks the deep wave and REM stages where your brain performs critical maintenance, including clearing out toxic proteins like beta amyloid that accumulate in Alzheimer's disease. A study published in the Journal of Alzheimer's Disease by researchers at Scripps Clinic Viterbi Family Sleep Center examined over 10,000 adults and found that regular use of sedative hypnotics was associated with a 35% increased risk of dementia. More alarmingly, research from the University of California, San Francisco found that these medications disrupt the brain's glymphatic system, which is the waste clearance system that operates primarily during deep sleep. Think of the glymphatic system like the garbage trucks that come through your neighborhood at night. If those trucks cannot do their job properly, trash accumulates. In your brain, that trash includes toxic proteins directly linked to Alzheimer's disease.